Sawadika. Good afternoon. Welcome back to our Health Dialogue by BDMS. I'm here today with Dr. Khemawan, Dr. One. So easy to remember from our eye center on the second floor of Bangkok Hospital, Phuket. And very glad to have you here with us.
Thank you.
I think the topic today, if you are already registered or see our advertising, the topic is quite long, but let me say, in brief, is cataract.
Yes.
Okay, that's a topic. But I heard that you are not only beautiful, you're also kind. Today, Dr. Wan also brings something for us. Okay, let's show what we have for them. If the audience today, if you are sending us some questions, and we will have special gift for you. I have to say, we have 5 pieces from Dr. Wan. So
we have like a set to help patients about the dry eye. So in the set is contained the gel that can provide the warm compressions, and they contain the artificial tears, there's no preservative, and the eyelid scrub. That you can use all of these to take care about the dry eye symptoms, and we have 5 for who look at the live now, right? And another 5 for
yes, we have our friends who are now watching our program also on Samui Island. So Dr. Wan also prepare for the other 5 on Samui Island. So we have 2 group of people today who gonna get our special gift for those who send us the questions, and we will random and give 5 pieces for Phuket people and 5 pieces for those who are watching us on Samui Island. Yes, and I have been using it. Yes, and I heard that Dr. Kim or Dr. Wan, Dr. Khemawan or Dr. Wan still have a lot.
If next time, if in case of we have chance to give you some more information about the eye again, maybe we can bring it more to you.
Yes. Okay. So the topic today is cataract.
Yes.
I think we have to begin what is cataract. I know many people know about this, but let's talk like we are here to introduce the cataract to our customer.
Yeah, as we discussed that everyone eventually get the cataract. Someone asked me, is it real? Because do everyone will have the cataract? The answer is yes, because cataract is a part of degenerative change. So that's about 50% for the one who older than 60 years old. The natural lens is changed. The change is in the color or the quality of the lens. That can be earlier in some patients. Example, the patients who have accident on some medication, example about the steroid eye drop or steroid tablets, or the patients who have some condition that make the inflammations in the eye. All of that can make the cataract come earlier before 60. But for the one who older than 60, that's 50% that have chance to have cataract. Yeah. So if I get older than 60, my lens can be changed also, and I will have the cataract also.
I mean, we have to come and check after 60 years old.
Normally, I'm recommend to check in steps, like for. We started at since birth. We have some doctor to look at the eye. His eye is straight, the eye is not cloudy. After that is a preschool. Like everyone want to know that when they want to bring the kids to the school, the eye is good or not, right? The kids have the good ability to see well or not. Then when they work, they use the visions with the telephone, computer too much. That can make the problem also. And then when we are 40 years old, the problem is happening because we will lose the ability of reading that we call the presbyopia. Like me, I see far very good for a long time, but when I'm older than 40, the reading for me is to be here. That is losability of reading that everyone will have after 40 years old. So 40 should be the good time to be checked. And then again, 40 is a timing that maybe the risk of the glaucoma can starting.
So
there's many problems.
Something pop up again.
So 40, I'm recommend to check, and maybe 50, and after that is depend on the findings in the eye, and again at 60.
Okay, and maybe not always the same because the activity will lead to different kind of symptom.
Yes, right.
Yes.
Yeah.
I'm thinking, for example, if I'm 50 years old, but I use my eyes or overuse my eye in reading or maybe using these kind of devices a lot, maybe the time will be or come closer.
There's some factors that can like from our organs, from our eye can get deteriorate in case of we spend long time with using gadgets.
Yeah.
But not everything. Like even we try many hours with the computer, it cannot make the cataract get worse. Some problem related, some problem not related.
Okay, but we will know more from you today, right?
Right.
I know that you prepare a lot of information for us.
Yeah, I want to summarize and make it easy because today we want to go into the question that's frequently asked.
Okay. So cannot wait for
Yep.
all the details.
Okay, so this slide is about the eye structure. The eye structures, we want to let you know that where is the cataract? The cataract is a change in the lens in the middle of the eye. So the lens, normally we born with the very clear one, but when we get older, it's changed to be yellowish. So from starting, it should be clear, but with time, it's turned to be yellow. And it can be changed to like more and more yellow or more cloudy. So sometimes when patients come into the hospital, we mentions about what is the stages of the cataract. So some stages is like very early, very little effect to the visions. So maybe at that time, not need any treatment.
I see, but maybe know the way to take care
Yeah.
and don't make things get worse too soon.
Like in case of we know about the stages, we can predict. Like now you are stage 1. That's about 3 to 5 years to step up to be stage 2.
Okay, you said predict, not prevent.
Cannot prevent.
Oh.
Cannot like there's some factor that we found that's related or make the cataract get progress. Example, UV light, or the one who have diabetes.
I see.
That's or the one who smoke. That's risk factor can make the cataract get worse.
Okay.
So with we reduce the sugar level, we reduce amount of sunlight, we stop smoking. That can delay the progressions of the cataract, but it cannot stop.
Prevent.
It cannot like not need. It cannot break it or stop it to go to the another steps.
Okay.
So at the end, it will step up.
Okay. Is that also include the second smoker?
No real evidence that talk about the second smoker. Yeah. And so when the cataract come, the symptoms come. That means, how do you know that the cataract is happened? The cataract is the lens that all the light will pass through the lens. So when the problem is with the cloudiness in the lens, so the light passes so good, so patients can have low visions, increased difficulty of visions at night, or glare hello at night, or double visions in single eye, or like the most common that is a frequent prescription change. It's like when we get older, not see clear, we go to the optic shop, and the optic shop make the new pair of glasses, and it's good for like few months, and it's changed again, and it's changed again, it's not so good again. The frequent prescription change is can be happened by the cataract that progress in the eye also. Yeah.
Okay. So listen carefully because we also have to help and support our eyes. We have only one pair, only one pair.
Yeah.
So we have to keep and try to be healthy, especially our eyes.
Yeah.
Okay.
Talking a little bit about the steps of the cataract, the stages of the cataract. The most common question is, this is a good time for me to have the cataract or not? Normally, we say that we want to provide the corrections when the cataract make big effect to the visions. As in this picture, that's shows stages of the cataract, stage 0, stage 1, 2, and 3. You can see the change in the color, or you can see the change of the cloudiness.
Yes.
So in case of is still state 1, is very little effect to the visions. At that time, maybe not need corrections. At state 2, I can say that's a golden period. That means it's not difficult to do the procedure and is provide like the fast recovery. Later than that, that would be state 3. With the state 3, you can see that it's more yellow. More yellow, that means more hard. So it needs like longer time of operation and longer recovery. So the golden period, the good time that we always recommend patients to have cataract is about state 2.
State 1 and state 2, can we check by ourselves just
It's
when we look in
a bit
the mirror?
difficult. But if the symptom is significant, it's mostly state 2 because most of the state 1 patient don't know.
I think so too, because if we cannot identify by ourselves, how can we step into the hospital and be on time or early enough or soon enough? So that means once when we realize that we already have something, maybe it's cataract. That means we already step into step 2, right?
It means like in case of you can have regular check, annual eye check, you will know something earlier. But if you waiting until the symptoms happened, with some symptoms maybe that's easily to correct it, but with some symptoms that may be not easy, like the glaucoma. Right? The glaucoma, when the problems come, is always late.
Yep. I see. Okay. Then I think when we do annual checkup yearly, we should also focus on eye checking, right?
Yes.
Because it's not only see the whole body, but also the eyes. Because so many people think maybe once when we have a special package in our hospital, it's always like, oh, for the eyes, maybe later. Oh, I don't have any problem yet. But now when I listen to you, I feel like I have to do annual checkup and include eye checkup.
Yes, I think most of the packages that's provided by Bangkok Phuket Hospital does include eye check.
Yes.
Yeah, or if not, you can ask the staff to do some check for the eye for you. Yes.
Wow.
Okay, so we step to the treatment. So we know that the problem is happens to everyone. We know that what is the symptoms and how can we correct the problems. So the treatment, that is the surgery only. Sometimes you can hear that like maybe Thai herbal that drops in the eye, or eat Thai herbal that can get rid of every eye disease. I have to say, by the surgery, by the cataract, surgery is the only treatment.
Okay.
So the treatment is we have to remove the old lens out, and we have to put the new lens in. Remove the cloudy, remove the yellowish out, and insert in with the clear lens.
Yes. Or it's maybe better than the old one.
Yes, it depends on the lenses we choose.
Oh yes. Many choices, many options.
Yes, we have. The option is depend on patient daily activities and patient demands, and like the structures in the eye also. Like we have the lens that we call the standard lens, that's provide the far side distance only. And if they want to read, they need the reading glasses. Or we can have the lens that provide all distance. The lens that can see near to far.
And driving.
And driving, driving and reading.
Yeah, I saw a lot of friends who were busy with wearing and not wearing glasses. The whole day, different activity, like in and out, in and out. And I think that's complicated.
Yeah, so
I like that you have option for our customer once when we need something. It's not just one choice for all. I think the activity of everyone's are not the same.
Right. Not everyone needs reading.
Yes.
Previously, I thought like everyone should need the best lens for all distance. But when we talk with patients, we know that this guy, these ladies really need the reading, or most of their activity is only far side distance. Or we can have the lens that can correct astigmatism also. The astigmatism, that is the focusing of the light is not equally from vertical and horizontal. So we can have the lens that can correct this problem also. So it depends on the findings in the eye. So that need examinations that need information from the eye, and then doctor have to talk with you. What is your daily activity?
I see.
By the structure and by the patient's needs. So what
So
is
eye structure also one of the choice, right? You
right?
cannot shoot whatever he like. Maybe the eye structure allow or not allow.
Right. Example,
Ah.
like in case of patients have diabetes that have
Oh.
effect to the retina already, that we call the diabetes retinopathy. That is the retina have a bleeding. In case of the retina has problems already, we recommend patients to go with only the standard lens,
I see.
not go to the very premium lens, because of even we use the best lens, but the retina can be changed and the visions can be destroyed by diabetes.
Yes, understand now. So anyway, once when we need this kind of treatment, we have to consult with the doctors, and yeah, as she just mentioned, there are many options, but you have to get your eye checked before making decision. And I'm sure that doctor will help and select the best that suits you.
Yes.
Okay.
So by the lens, I think that's very the new lens come in, like is launched new one every 1 or 2 years. So we just you like
you don't have to upgrade it, right?
It's only one time in your life to choose a lens.
Okay.
So we plan to like put into the eye, and this lens can be used for lifelong.
Wow.
Not need to change again.
Okay.
So that's very important to discuss carefully with doctor that what is the lens that you want, what is your needs of seeing, and what about the eye structure.
By experience, some friends of me also mentioned that the insurance company only pay for the standard one.
Right.
But my friends also make decisions, select the best one that suits him, because as you just mentioned, once in lifetime, and your activity may be not suit for the standard one.
Right.
So you prefer better lifestyle, or you have to do more activity, then someday intend to pay even the difference for the costs.
Yeah, most of the insurance companies say like that. They say that the standard one, it should be fit for everyone. But I'm not sure, but there's some insurance also that pay for the premium lens. I think it's depend on the policy that patients buy.
Yes.
Yeah,
also
so
depend on the premium that they pay for the insurance
because
company.
we did have patient that the insurance pay for even the best lens. So I think we check first,
yes.
make examination first, and in case of the premium lens is possible, we discuss and we ask the insurance.
Yes, we can. Doctor will provide the document and send to the insurance company for pre-authorization. And once when we get this confirmed, then we can start the treatment.
Yes.
Yes.
Okay. I think it's about the lens. Patients that have the little problem of the cataract, they have time to wait and see the technology that moving forward. But for the one that have cataract already, the one that the lens that available today, I think that is very, very, very good. Example, like the lens that available today, they have about 87% chance to read a magazine without glasses, together with CFAR 2020. 2020, that's mean normal.
Normal,
That's
yes.
mean CFAR normal, and reading a magazine without glasses, 87.
If it's not 2020, it means not normal.
Right. That is 87% chance to read a magazine without glasses, or about 90% chance to use a computer without glasses.
And how about mobile phone?
Yes. Without glasses.
Is it also 87%?
About 87%, but I think that can be higher and higher with time. So maybe it's not the limited of the lens, but that is the technology that can provide the result like this. It's true that can be improved with time, but I think right now 87 or 90% up like this, most of the patient is happy already. Okay, that is about the lens that we always have a lot of questions about the lens. And the most common question also that's about is it dangerous?
Yes.
The procedure, is it dangerous?
It sounds very easy. It sounds like we can fix it within a day. And
Yes.
life will change.
Yes.
Is there any risk?
Yes, every procedure have risk,
I see.
right? Every procedure have risk of bleeding and infection. That's normal, right? It's happened in every procedure.
Nothing
For the-
100%.
Right. And for the cataract operation, the infection rate is 1 in 10,000 cases. It's not quite high.
1 in 10,000.
Yes.
Wow.
Yeah, and we have to discuss that how to prevent the infections, right? Because patient don't want the complications to be happen, doctor don't want it to be happen also.
No one want that.
Yeah, so we have to discuss how to prevent all the complications. Or another complication that's serious, that is bleeding. Bleeding is 1 in 30,000 cases. It's quite lower, right? With the bleeding risk and infection risk, that can make the eye get loss of vision. That is a thing that we don't want it to be happen, but we can try to prevent. Like for the bleeding, we talk about patients have any underlying problems. They have hypertensions, the medication, yes,
blood thinners,
right. So in case we can reduce the risk, that will give the better chance of seeing, right?
Yes. My experience again, once when we consult about or prepare a pre-operation, we also discuss about medication that they're taking, and maybe some kind of medication has to be like paused or stopped for a week, kind of, and then come for the operation. And,
that is very important.
And then are observed and then continue the medication. So set priority. Which one is more important at the time?
So that will be the information that necessary. So when you want to consult doctor about the cataract, you have to identify the problems in your eye, the low vision or the frequent prescription change, or you just want to see better, see far or near with us. Two, you have to identify what is your daily activities. How many hours with computer? How many hours with tennis, golf, or what else?
Do you also persuade them to change the activity sometime to get better eye condition? It's difficult, I think.
By some condition, we have to ask patients to change some things. Like if the patients have the macular problems, we don't want them to spend long time under the sun. Very bright light is not good conditions, and that can make the macula change. Or the smoking, if you can stop the smoking, that will reduce the risk of the macular problems. Something that need that's serious, that should be advised by doctor. Okay. And please bring the medications or health report to talk with doctor that with all the conditions like this, how to prepare for the operations.
Yes, I think, how long will it take?
2 hours, okay. I skip that step, sorry. Yeah.
So many, I mean, even consultation as well take a long time because you need to know all details that concern the health of the patients, right?
We need about 2 to 3 hours in the hospital.
Wow.
And that time we need about we need someone to be with patients, because we have to put the medications in the eye to make the pupil get bigger, and patient cannot drive back. Okay, so we need 2 to 3 hours in the hospital on the day of examinations.
Yes.
On that day, we will provide all the medical paper for the insurance or what else. And then we schedule the operations. On the operations day, we need about 3 hours in the hospital also. 1 hour in the operating room. The timing for surgeon to touch and finish may be about 20 to 30 minutes.
Okay. But as I experienced here in this hospital, I have to say, well prepared indeed, because we always explain to the patients, especially those who has a condition or bad condition in the eyes. I saw even the staff read all information for the patient, because the patient cannot read things by themselves. Yes, and the patient instruction is quite clear. But besides that, if you still have any questions, you still can ask. Either doctor herself or our staff, at the station. Yes. Okay, then
I think we have questions, right?
I saw it.
Can you have cataract surgery without having a lens implants replacement? In the other word, if I have been wearing glasses for most of my life, can I continue wearing glasses? With collective lens by simple having. Okay. I want the slide that take the old lens out and put the new lens in. Okay. The technique of the surgery that is remove the dirtiness lens out. The lens, our natural lens is work like a convex lens. So once we remove the convex lens, we need another convex lens to focus the light in the eye. So if we just remove it out, but we not insert another lens in, is very hard for light to focus by the prescription glasses. And you understand?
I understand that.
Yeah. So in my experience, I do the cataract surgery nearly about 15 years, more than 1,000 cases. I thought there's only few cases that they have very nearsightedness. That their eyeball is very, very long. So then, and we don't have the lens. We don't have the power of the lens. Like, or sometimes we need the lens that power 0. So at that person, that's possible to not need the lens in. But in overall 99.99%, the lens is still need.
It's maybe 1 out of 100,000 cases, kind of. The percentage
Okay,
is very
so
low.
we are going to go to the second question, please.
Yes. I prepare many questions, but since you explained to us, you already answered all the questions in my mind.
Thank you. Yeah,
The
question
second
number
question.
2. Yeah.
I saw 2 questions on the same page, but I need more questions.
Yeah,
Because we have the bone compression gel that will give to our client.
Okay, the second question.
Yes.
I can see that you are suggesting a Technis brand lens. Oh, sorry. I'm so sorry about that. For Technis is a good brand in here, but because the slide that I not have enough time to prepare the slides to be the standard lens from many company, but Technis is a good lens that we commonly use in Bangkok Phuket Hospital. That's another brand that we use also, like the Alcon or Size company.
Yes. At least 3 options.
Maybe more,
Okay.
but that is the most common that we use. Sorry about that. Okay.
So we have the audience who are watching us from Phuket Island. It's very sunny. I'm not sure about the weather today, but mostly sunny, like more than half a year, and also on Samui Island. So wearing glasses, I saw in marketplace, I have to say, like weekend market, local market, there are many glasses, like sunglasses. Is that okay to wear the glasses like that? I mean,
that kind of glasses maybe have the good tint, brown, dark, or what else. But the thing that we're not sure, that is UV protections.
So then maybe have to focus on UV protection if you want to protect our eyes. It's not only just looking good with that sunglasses.
Because UV have, there's scientific proof that the UV light can make the problems to the eye, like the pterygiums, pedicula, cataract, and macular degenerations. So with the lens that we trust, the brand, maybe they can provide a good UV protection also with the brand that in the market. I think that's difficult for a buyer to know that is the UV protection in this or not, right? But in the hospital can check. You can buy from the market and you can ask to check in the hospital that these glasses have UV protections or not.
Yes, but I think with UV protection, maybe it costs a lot. The lens that get UV protection. So to help your eyes, maybe not only the sunglasses, but also the umbrella.
Cap,
or
umbrella,
hat. So you can be also chicken cool with those stuff. And I think taking care of the eyes, besides wearing sunglasses, for many beautiful ladies who like to wear makeup, is that also disturb our eyes, or for example, eyeliner, mascara,
Yeah.
and also the lens that is like fashion one, fancy one.
Yes.
Can you give us any suggestions about that?
Yeah. For the fashions, contact lens is dangerous.
It's dangerous.
It's dangerous. So in case of it's necessary, like you have to use it, please use it less and like have a good clean, take it out, not leave on, and sleep with the contact lens, and not share with the other ones.
Oh.
For the cosmetic, there's some report about the eyeliner that can make the eye get more irritations. And if you want to do the cosmetic on the eye, please do a little bit outer than the lash line, not inner than the lash line, because this can make irritations and have the problem with tear productions.
Okay.
That's another question. Can you explain more about this rest regarding focal points? Lens regarding focal point? I'm not sure. I guess, okay. Maybe we can go back to the type of lens. Sorry, maybe this is the last questions. As I explained, yes, ka. I'm sorry that I have to pick up the Technis slide because of the Technis brand have wide variety for us to use. But that's possible to have like the another brands also. As you see in this slide, there's one focusing that's on the bottom. That's CFA only, that is monofocal. Or the top one that can read until CFAR. That is all distance. That kind of lens we call the extended depth of focus lens. That means extend focusing from near to far. And in the middle one, you see the three circle.
Circle, yes.
That is the trifocal lens. That is focus 3 points. Yeah, so that's a little different from trifocal to the extended depth of focus. That is the continuous of the visions, not 3 spots.
I prefer the top 2.
I'm not sure that I answered that question or not.
If not, you send us the questions again and we will send you the answer. So after listening to our Dr. One, I was a Dr. One, and we know a lot more about cataract. But anyway, if you still have questions about cataract, you also can reach us or call like 1719 and connect to Eye Center on the 2nd floor, or send us an email via our website like World Wide Web, PhuketHospital.com, and also stay tuned with our Facebook. Oh, there are many channels to contact us, and also we have Line app that you also can be a member of our expat links. And yeah, as I say, or step into the hospital. We are clean and clear here in this hospital. Yes, and we will random and send the gift to your address. And if you will come in, for example, if you are the one who lucky and get our price here, just let us know that, oh, you don't have to send to me. I will come into the hospital.
Oh, that's really nice.
One.
Yeah, that's really nice, because I'm not sure that you understand that I teach you to use or not. You can come in the hospital and bring it inside, and someone will teach you how to use it.
Okay. And Dr. One is still there with us in the hospital. So any questions, please come in and consult our doctor directly. And stay tuned. Next week on Thursday, the topic will be medication or medicine management for those who are living on this island, or for those who are stuck on this island and you still cannot go home and you have to refill your medication. But maybe you need to do some check and you need to adjust your doses. So stay tuned with us next week on Thursday, 2 o'clock, and we will talk to the pharmacist. Thank you for today. Thank you, Dr. Wan.
สวัสดีค่ะ
Thank you, everyone. And goodbye for today. See you next week. Bye-bye.